everyone, this is Dr. Saba Fathima, Consultant Obstetrician and Gynaecologist at Motherhood Hospital, HRBR, Bangalore. I am going to discuss about fasting during Ramzan and what are the precautions women need to take while fasting. What are the conditions which medically prohibit women from fasting and what are the complications which arises if the woman is fasting. These are the two topics which I am going to discuss in my short video today. I have briefly classified my inputs into two categories, women in the pregnant age group and the women in the age group between 12 to 45 who are non-pregnant. Now coming to the first group, I have divided this into 3 trimesters as pregnancy. Pregnancy of first trimester, second trimester and the third trimester. First trimester begins from the conception up to the 12th week. Normally, in pregnancy, especially in first trimester, the calorie requirement is same as a non-pregnant woman. Hence, most of the women don't lose any calories if they are fasting, but fasting is not tolerated well in early pregnancy because of the nausea, vomiting and the hyperemesis gravidarum. If you are not able to fast or if you have vomiting or if you have something called GERD, it's better to avoid fasting or take medical intervention, only then you can continue a fast. It's better to avoid continuous fasting and plan intermittent fasting. Second trimester starts from 13 weeks and ends at 28 weeks. The calorie requirement in the second trimester is plus 350 calories compared to the non-pregnant women. Though vomiting are much less and fasting is better tolerated in second trimester, but we always have to give consideration for malnourishment, calorie deficit and protein deficiencies. Always consult your doctor before undergoing or planning to do fasting. There are some studies which have shown women who fast for continuously for more than 30 days, they tend to develop small placentas and low birth weight babies. And if you have a medical disorder like diabetes or if you are gestational diabetic on insulin, it's better to avoid fasting during pregnancies in order to prevent the complications. Now coming to the third trimester starts from 28 weeks and ends at full term. The calorie requirement in the third trimester is almost plus 550 calories compared to the non-pregnant women. Third trimester is a safer period, but consideration has to be given for the reflux which develops in third trimester, which is called GERD. It gets worsened if you have twin pregnancies or if you have polyhydramnios or if you have over-distended uterus, because nausea and GERD stimulates vomiting, and once you start vomiting, fasting will not be allowed in Ramzan. Hence, always consult your doctor before undertaking it. And if you are a diabetic on insulin, it is preferable to avoid fasting. Now the second category of group is women between the age group of 12 to 45. The most common condition which prohibits women from fasting in this age group is menstrual disturbances. Menstrual disturbances can be prolonged bleeding, irregular bleeding, prolonged spotting before, during and after periods or more frequent periods. Since fasting happens only for a month, I don't think any woman wants to miss an opportunity to fast during pregnancy. It is better to get the problem addressed as early as possible so that you don't miss the opportunity. So the first thing is to get yourself examined, meet your gynecologist at the earliest. Get yourself tested to find out the causes so that the treatment can be given. The most common causes for menstrual disturbances is DUB or dysfunctional uterine bleeding, polycystic ovarian diseases, hypothyroidism, endometrial polyps, endometrial hyperplasias, fibroids or ovarian cyst. The treatment always depends on the cause. If it is a surgical problem like fibroid or endometrial polyps or hyperplasias, it needs to be addressed surgically. If it is a medical problem like a hormonal disturbance or it is hypothyroidism or it is polycystic ovarian syndrome, it can be addressed medically. There are 3 different line of drugs which are used in the treatment of irregular periods. The first line of drug is tranexamic acid, which is non-hormonal, and then it reduces the bleeding by almost 30 to 50%. The second line of drug is oral progesterones. The third line of drug is called combined contraceptive pills. The treatment, as I said earlier, depends on the cause. So don't miss the opportunity to fast just because of the disturbance in the periods, get yourself investigated and treated so that you can fast as many days as you can. Now, to conclude, fasting is very important aspect of Islam, and fasting has to be done for consecutive 30 days. But if you are a patient, or if you are pregnant, or if you are a non-pregnant person with medical disorders, or if you are a woman with menstrual disturbances, fasting is prohibited upon you. This can be compensated once Ramzan is over by intermittently doing it throughout the year. But most of the women doesn't want to miss an opportunity of fasting during Ramzan. Hence, consult your doctor before Ramzan starts, and in between fasting always make sure that you are in touch with your doctor, so how to avoid the complications and how not to miss the opportunity of fasting. Thank you.